I'm Dr. Karishma Kagodu, a board certified plastic surgeon, and I practice in Bangalore, India. The name of my clinic is Dr. Karishma Aesthetics. Today I'm going to talk to you about the mommy makeover process. So a mommy makeover process is a combination of cosmetic and plastic surgical procedures which is done for a woman in order to get her back to her pre-pregnancy or pre-delivery state. So when we talk about a mommy makeover procedure, these are usually final procedures. This is done when a woman has completed her entire family and she is prepared to get back to her pre-pregnancy body. And it is not advised for those women who are planning future pregnancies. So to start with, we are going to talk to you about liposuction with abdominoplasty, also called as the tummy tuck surgery. So this is just one of the procedures which is taken up by us in order to provide you a good contoured midsection of the body. So in an abdominoplasty, a liposuction is always combined. Now, when one gets pregnant and has probably multiple pregnancies and many deliveries, one notices there is an expansion of the skin in the abdomen area. And when this skin is getting repeatedly expanded, it is very difficult for many women to get it back to its pre-pregnancy state. Of course, I do believe there are a lot of women these days who are working out and dieting very rigorously, and they are able to get back into their flat abdomen profile. But there are many women who struggle with this process, and for them we have the procedure called as the lipo-abdominoplasty or the tummy tuck surgery in order to give them a good abdomen profile. So who is the right candidate for a tummy tuck surgery? A woman who has completed her family and she's no longer planning to have future pregnancies. Say a woman has completed her last child and has completed breastfeeding. So 8 to 10 months after the breastfeeding has stopped, she can look to undergo this tummy tuck surgery. So in a tummy tuck surgery, we first analyze the patient and we look at what are the areas of lipodystrophy around the tummy area. Now in a woman, mostly we notice there is an excess skin and belly fat, and the excess loose skin is usually in the lower part of the belly, and there are excess deposits of fat in the upper abdomen, the sides of the abdomen, along the waistline as well as the lower back. A few women also have fat deposits in the brow road area. So when we start the tummy tuck surgery, we will first look at the areas where liposuction is required, and this could be the waistline, the upper abdomen as well as the lower back and the love handle region. So we start the procedure by doing a circumferential or a 360 degrees liposuction, and this liposuction is then followed by removing excess skin in the lower part of the belly. Now a tummy tuck surgery involves multiple steps. First, starting with the liposuction. Second, planning the removal of the lower lower belly skin. The third process is, in most women, they do develop an umbilical hernia post multiple pregnancies. So we will repair the umbilicus and reposition it to a better profile. Then we also repair the weak abdominal muscles. The central muscles of the abdomen we call the rectus muscle. So these muscles are brought back to its original state and is repaired. So these are the steps involved in a tummy tuck surgery, and this is what is explained to you when you are going to undergo this procedure. So the tummy tuck surgery starts by doing certain markings on the patient's body. So the lady comes to us on the day of the surgery, and usually they are fasting the previous night, and on the day of the surgery we do a multiple amount of pre-procedure markings. These pre-procedure markings act as a guideline for me in order to make the cuts during the procedure. So the most important thing is we mark out the areas where liposuction is needed. Then the lower belly skin which needs to be removed is marked out. And if you notice in the patient's profile that they have a lot of excess lower belly skin. So when we remove the lower belly skin, the top part of the abdomen skin is stitched to the lower part of the abdomen area. For those women who already have a pre-existing C-section scar, the cut that we make in a tummy tuck surgery will be along the C-section scar. But because we need to remove so much of skin extending sideways, we extend our cut in the lower bikini line. Now it depends on what undergarments a woman is wearing, and we can plan the incision and the final scar for the lady depending on her choice. So we have lower cuts and we have higher upper cuts. So in a tummy tuck surgery, we can plan your scar and we make sure the scar is hidden within your panty line. At the end of the tummy tuck surgery, we have now created a new abdomen profile. We have removed all the excess skin and the abdomen has a more flatter appearance. It has a more toned appearance. We have repaired the weak abdominal muscles. We have repositioned the umbilicals to a new position. At the same time, at 360 degrees, you are having a better contoured waistline. So tummy tuck surgery is for those who are wishing to get back into shape and they are struggling with their midsection profile even after rigorous dieting and exercises. They have probably lost the tone of their abdomen muscles post multiple pregnancies, possibly have an umbilical hernia or an abdomen hernia. So for all of these medical reasons too, tummy tuck surgery is the procedure of choice for you. And I think after watching this video, you will be more aware of what happens in a tummy tuck surgery.